What do LSIL and HSIL Pap smear classifications indicate? Imagine your Pap smear results as a report card for your cervical health. When you hear about LSIL and HSIL, it's about how your cervical cells look under the microscope and what that might mean for your health. These classifications help doctors understand whether there are abnormal cell changes and how serious they might be. LSIL stands for low-grade squamous intraepithelial lesion. It means there are mild abnormalities in the cells of your cervix. These changes are often caused by an infection with human papillomavirus, or HPV, which is very common. In fact, most HPV infections clear up on their own without causing any problems. When a Pap smear shows LSIL, it usually indicates early changes that are low risk for turning into cancer. These mild changes are often called low-grade lesions and are associated with HPV types that tend to resolve naturally. Because of this, doctors typically recommend watchful waiting with follow-up Pap smears to see if the abnormalities go away. It's important to remember that LSIL does not mean you have cancer. It's a sign that your body might be fighting off an infection or that the abnormal cells are still in the early stages of change. HSIL stands for high-grade squamous intraepithelial lesion. This indicates more serious abnormalities in the cervical cells. These changes are considered high-grade and are more likely to be precancerous. HSIL corresponds to moderate to severe dysplasia, which in medical terms is called SIN 2 or SIN 3. These are more advanced cellular changes that have a higher chance of progressing to cervical cancer if left untreated. When a Pap smear shows HSIL, it means there is a significant abnormality that requires further evaluation, usually through procedures like colposcopy and biopsy. Most cases of HSIL are linked to persistent infection with high-risk HPV types, which are known to be associated with the development of cervical cancer. Because of the higher risk, healthcare providers often recommend treatment to remove or destroy the abnormal cells and prevent progression to invasive cancer. In essence, LSIL and HSIL are part of the cervical screening process designed to catch changes early. LSIL usually involves mild abnormalities that often resolve on their own, while HSIL indicates more serious changes that need prompt medical attention. Both classifications help guide the next steps in care, whether it's simply monitoring or more aggressive treatment. Understanding these results is key to preventing cervical cancer, which is a major reproductive cancer. Regular screening and follow-up are essential because catching these changes early can make a big difference in health outcomes. Always remember to discuss your results with your healthcare provider, who can give personalized advice based on your overall health and risk factors.